If you have tested positive for COVID, otherwise healthy individual with no comorbidities and perfectly good health, you should first consult a medical doctor and seek their opinion. Check your vital signs. We need to get certain blood investigations as well. Once the preliminary checkup and investigations are done, then it would be decided whether the individual can be isolated at home or whether he or she would require hospitalization.
We talked to Dr. Anup Banur, consultant pulmonologist and also an associate professor, on how we can self-monitor while maintaining home isolation.
One important thing is to have a pulse oximeter at our homes to monitor ourselves. Most important thing with COVID is when it affects lungs, it causes difficulty in breathing. Patients' oxygen saturation drops. They require supplemental oxygen therapy. They would need high flow nasal oxygen, non-invasive ventilation and even ventilation as well. So to determine whether the patient needs hospitalization or whether to keep a check on his progress, pulse oximetry is an essential tool. With pulse oximeter, one should make sure that their hands are warm, their hands are not wet, and if they're wearing nail polish or nail paint in any of their fingers, better to avoid that particular finger to check pulse oximetry. Usually we prefer the dominant hand's thumb or middle finger, and we should keep it like this and press the button. And one other important factor is, when we are looking for pulse oximetry, we should make sure that we should wait for at least 15 seconds.
If a pulse oximeter shows one's oxygen saturation level as 94% or higher, then it indicates a normal range. But less than 94% demands immediate medical consultation.
If hospitalization is not possible, or those who are in the recovery phase, maintaining saturation but still short of breath, we recommend what is called as proning, awake proning. In that, it is a simple method. An individual has to lie on his stomach for about 45 minutes to 1 hour and then change to lie on their left side or left lateral position, continue in that position for 45 minutes to 1 hour, then change to right lateral position, lying on the right side for 45 minutes to 1 hour, and then sitting upright. There are two types of treatment. One is pharmacological, that is medications. Depending upon their symptoms and depending upon their lab values, one decides what medications to be given. And along with pharmacological treatment, there is non-pharmacological treatment as well. Non-pharmacological is without any medications. The most important thing with non-pharmacological treatment in individuals with COVID are they should maintain hydration and good nutrition. One should not Google and self-medicate themselves, and certain breathing maneuvers like incentive respirometer is one thing which one could do when they are isolating themselves at home. We take this respirometer, keep the base of it straight to our mouth, and try and take a deep breath and hold these things for as long as possible at the top. It is not important how frequently we move these things up and down. It is important to hold our breath and keep these things at the top. So we usually recommend individuals to do this for at least 2 minutes and for at least 6 to 8 times a day. Even if one tests negative for COVID but has symptoms consistent with COVID, the non-pharmacological methods what I mentioned are going to be the same: nutrition, proper hydration, breathing maneuvers.